Hi there, thank you for joining me again on this episode of Self-Manageable Illnesses and Their Treatments. I hope you watched some of my videos because today the topic I'm going to talk about today is again something to do with sexual health. I talked about candida and thrush last time. So this time around, I'm discussing another topic to do with sexual health. And so what am I talking today about? It's about BV or bacterial vaginosis. Now, if you haven't watched my video on candida or vaginal thrush, I'm sure you are going to want to watch that because this is also links with that video. Now, what is bacterial vaginosis? Bacterial vaginosis, as the name terms, is a multiplication of bacterial flora in the vagina to the point that it causes discomfort and infection. Like I mentioned before in my last video about candida or yeast infection. Now, there's a balance between bacteria and fungal flora in the vaginal area. In bacterial vaginosis, the bacteria multiply and go so high. In other words, the environment in the vaginal area makes it conducive for the bacteria to multiply. And when they multiply, they overshadow any other microorganism in that area and causing what is called bacterial vaginosis or BV. So what causes BV is a bacterial infection, like I said. Yeah, so what are the symptoms of BV? This is very important, so listen very carefully because there's a slight, tiny difference between symptoms of thrush and symptoms of BV. They both involve itching. They both involve discharge. They both involve discomfort of during going to urination or burning sensation. But there's another key difference between both of them, apart from the treatment, is the discharge and the color of the discharge. Yeah, so for instance, in bacterial vaginosis, the discharge is gray, it's not white, just like you have in thrush. The bacterial vaginosis, the discharge is gray, it has a awful smell. Some call it smell of fishy smell or horrible smell. The discharge is gray, it's horrible looking. Yeah, so that is a key difference between bacterial vaginosis and thrush, apart from the treatment. So that is what I want to point out specifically. Also, there is a confusion between other sexually transmitted illnesses and bacterial vaginosis. How do you differentiate between them? How do you differentiate to know which is which? Yeah. So, for instance, in bacterial vaginosis, you see all these symptoms I've mentioned. But if it's an STI, you get what we call other accompanying symptoms like fever, like nausea, like backache, and also when you try to treat the bacterial vaginosis, even after a few days treatment, it doesn't get better, it really gets worse. So if you have such discharge, foul discharge, that also is accompanied by high temperature or nausea or feeling or lower abdominal pain or backache, my advice is to consult your doctor or see a pharmacist because that could be a sign of some underlying more serious sexually transmitted infections. And also, whenever you have BV, my advice is please try and get it treated. Because the problem with BV is that it can complicate, it can make worse, it can increase the chance of getting other sexually transmitted infection, which can be serious. Okay, and now if I go forward again and talk about what can you do to prevent it, what can you do to prevent before I go on to the treatment? I know that tight fitting wear like tights is not good. Some people tight fitting wear or wearing tight can also destabilize the bacteria or the vaginal flora. So if you're the type that are prone to such infections, avoid tight-fitting wears. That's one thing you can also do to stop or to reduce the chances of bacterial vaginosis. Also, maintaining a warm partner is very important. How about treatment? There is an over-the-counter treatment of bacterial vaginosis. Now, like I said before, BV is caused by a destabilization of the flora in the vaginal area. So we normally treat it with what we call lactic acid derivatives. There's a lot of medications over that you can buy in a pharmacy. Some of them are 7-day treatment course, which can help to establish the balance, the pH balance in that area, and restore it, and also eradicate BV. So that is the point I want to make about BV. So if you feel you have it, the treatment is easy, but like I said, you've got to make sure that what you have is BV and not STIs. Finally, like I always say, there are warning signs when you have BV. So if you have multiple partners and you have BV, my advice is consult your doctor, see a pharmacist to make sure it's bacterial vaginosis and not any underlying sexually transmitted infections. If you're pregnant, my advice is also to consult your GP or doctor, or consult your midwife, so that they will make sure that what you've got is bacterial vaginosis. In any case, treatment of bacterial vaginosis in pregnancy, care needs to be taken because you have to put the baby into concentration. So I hope you have gathered some information and also been enlightened about BV, the causes, how to manage it, and how to treat it. Like I said, the symptoms are similar. You get that burning sensation, you get that discharge, but it's a foul-smelling discharge. And also, you get that itchy feeling and burning sensation. These, once you restore the bacteria and the balance between bacteria and vaginal flora, that will be rectified. Thank you for watching again, and don't forget to look at my video on thrush, because that will help you to begin to differentiate and understand how to know what you've got, whether it is BV or whether it is thrush. Now share, comment, like I've always said. If you have topics that you want me to deal with or to talk more about as a pharmacist on SITT, I'm happy to look into it and discuss any of them. Thank you and goodbye for now.